strong defense line. Premier Li Keqiang also requests to prioritize the tasks and win the battle against the COVID-19. And the topic for today's conference is about the prevention of overseas importation. So we have with us DDG Zhou Yuhui from the Bureau of Disease Control of NHC, DDG Song Yueqian from the Department of Health Quarantine of GACC, Director General Liu Haitao from the Border Inspection and Administration Department of the NIA, and Deputy Director General Sun Shaohua of the Operation Monitoring Center of the CAAC. So they will take questions related to today's topic. Let me first give you the update of the pandemic. Yesterday, between 0 and 24 o'clock, China's mainland reported that for newly increased confirmed cases, the number is 12, including 8 overseas imported cases, respectively Heilongjiang 4, Shanghai 3, and 1 in Guangdong. 4 are indigenous cases, respectively 3 from Heilongjiang and 1 in Inner Mongolia. There's no fatal case increased, and the increased suspected cases numbers 2. Both of them are overseas imported cases and suspected cases in Shanghai. Yesterday, 22 cases are cured and discharged from hospitals. Close contacts removed from medical observation 904, and the number of severe cases dropped by 4. Yesterday, concerning the overseas importation, now there are 841 remaining confirmed cases, including 43 severe cases. Remaining suspected cases number 39. In total, there are 1,583 confirmed cases, 742 cases cured and discharged from hospitals, and there's no fatal case. By the end of yesterday, China's mainland reported that for remaining confirmed cases, 1,031, including 81 severe cases. In accumulative terms, the number of cases cured and discharged from hospitals is 77,084. Total deaths, 4,632. For reported confirmed cases, the total is 82,747, and there are 43 remaining suspected cases. Close contacts traced in total 725,814, and the close contacts still under medical observation 8,694. For Hubei, yesterday there was no new confirmed case and no fatal or suspected cases. 4 cases are cured and discharged from hospitals yesterday, and the remaining confirmed cases numbers 105, including 20 severe cases in Wuhan. In total, the number of cases cured and discharged from hospitals is 63,511, including 46,359 in Wuhan. In total, the death case numbers 4,512, including 3,869 in Wuhan. The accumulative confirmed cases number 68,128, including 50,333 in Wuhan. China's mainland reported that for newly increased asymptomatic infection, the number is 49, including 5 overseas imported cases. Yesterday, there was no asymptomatic infection transferred to confirmed, and 58 cases removed from medical observation, including 7 overseas imported, and there are still 990 asymptomatic infections under medical observation, including 184 overseas imported. In total, from Hong Kong, Macau, and Taiwan, the reported confirmed case number is 1,490, including 1,025 from Hong Kong SAR, 45 from Macau SAR, and 420 from the Taiwan region. Over the past week, the remaining overseas imported case is being reduced. However, we see a rising risk concerning the overseas importation by land. There have already been related cases indigenously and also cluster cases. This means that we should make sure the entry points do not become the windows of overseas importation, and we should overcome the weak links, strengthen personal protection, and curb the spread of the pandemic. That's all for the update. Now we're going to have the Q&A. Please focus on today's topic and put forward your questions. Please identify yourself. Now the floor is open. The first question on the right, on the second row, the third gentleman reporter, please. Thank you. With Phoenix TV. To ensure the stability of the international supply chain has become a priority. While ensuring the smooth transportation, how can you ensure the safety of the staff and the crew members in international transportation? We will have DG Liu to take the question. Thank you. At the moment, the daily inspection at the border is about 20,000 times, accounting for 60 or 70% of the total entry. Following the CPC Central Committee and government's request, we have strengthened collaboration with the competent authorities such as the Health Administration and the Customs Administration, ensuring the safety of the people while also providing convenient access to transportation. We've done the following three things mainly. The first is about international sea transportation. In principle, the foreign crewmen or sailors were not allowed to land in China, and for Chinese sailors, if they are qualified, then they can land. For sailors who have not been on the sea for more than 14 days, then if they need to land, then they will take the land quarantine as requested. For the trains and buses, the vehicles and the crew members will receive the inspection and quarantine accordingly. For overseas trucks, they are requested to unload in designated places. The staff should leave the country on the same day. For Chinese truck drivers, they are subject to the record keeping and the journal keeping and take the NAT to guard against the potential pandemic. For international crews on the aircrafts, if they don't leave the airports and if they need to take the direct flights to other countries, then they are exempt from the border procedures. In airports with available conditions, there are special pathways or channels to inspect and monitor the health status of the crew members to avoid or to minimize the exposure. Okay.
Thank you. With people.cn, the steering and leadership group of COVID-19 response by the central government has pointed out that we are still faced with the mounting pressure of the imported case risk and the domestic resurgence risks. What are the measures adopted by NHC to respond to the complex situation? In Beijing and Harbin, the NAT tests are open to the general public. Will other cities also have available NAT tests in cities with higher risk of imported cases? I'd like to ask DDG Zhou Yuhui to take the question. Thank you for your question. In the context of the complex situation, we must fully deploy the overall strategy of prevention of imported cases and prevention of domestic resurgence. Emergency response should be combined with targeted measures and regular approaches while we promote the recovery of economic and social normal orders. We should focus on the prevention at the main border cities, guide the border cities to work out targeted prevention and control plans. Meanwhile, we will enhance personnel resources guarantee for these border cities, conduct NAT laboratory tests, quarantine, and make good preparation for emergency response, make up for the weaknesses. Second, we'll continue to consolidate the responsibilities of local governments, enterprises, organizations, and individuals. The key organizations and key individuals should be covered. We should have a region-specific, categorized, risk-based approach. Third, we'll continue to implement the 4 earlies, the early detection, reporting, quarantine, and treatment, and continue with the good job in community prevention. Early and rapid detection, rapid treatment and response, and targeted and precise management, effective treatment should be important components of our regular and routine efforts. Once cases are identified, we must deal with them promptly to stamp out any case, prevent it from further transmission. In well-conditioned localities, NAT tests have been provided to the general public who need such tests or who proactively want to be tested. This work can help the general public to get rid of the unnecessary worries. Their family members and their colleagues and co-workers can also get rid of such worries. This can help the resumption of business. Thank you. Next question, please. Journalist from the first row on the left side, please. Thank you. With CNR. On April the 1st, GACC began to conduct 100% AAT tests on inbound travelers. The NAT test capacity has been an important technical support to improve the border prevention control. What are the specific measures adopted by GACC to improve the border testing capacity to ensure that we can detect the cases and we can ensure the tests are accurate? DDG Song Yuqian is taking the question. Thank you for your concern of our testing. Testing capacity is an important component of public health measures by GACC at borders. It is also an important guarantee to prevent imported cases according to the important emphasis by President Xi. We have been following his emphasis to improve the testing capacity. We have implemented and been optimizing the treatment capacity protocol. We have issued 6 editions of prevention control at borders and specific measures. Meanwhile, we have been dynamically adjusting our methods in the collecting of the test samples, refine the places, the practices of testing disinfection measures, and gradually improved the on-site testing capacity. We looked at the testing capacity, the inventory of protective equipment. GACC has been allocating resources and equipped major and risky ports of entry with the PCR testing equipment, the blood routine analyzers, and the negative pressure quarantine units. Biosafety labs were also distributed to some major ports of entries. The testing equipment and the capacity at the points of entries have been improved. Third, we've enhanced personnel training. GACC has organized a 12 technical experts team, and they were distributed to key points of entry to provide further training. Along the process, epidemiological survey, testing, and other standard procedures have been important components of the training program. Meanwhile, at the customs of different localities, we've organized specific training programs, in particular the online personal protection training. We've worked out an exercise booklet for the GACC members to do more exercises so as to familiarize themselves with the information. Fourth, we've enhanced the joint and coordinated prevention and control among different departments. Local governments have sent 800 plus technical experts to support the local customs to improve epidemiological survey and NAT tests. At the key places, the health quarantine facilities have also been improved. The medical supplies have been delivered to these major ports of entry. Thank you. Next question. Journalist from the second row on the left side. Thank you. With CCTV. The Beijing International Capital Airport has been implementing the shifting of the first point of entry policy for some time. What has been the progress now? Deputy Director Sun Shaohua from CAC will take the question. Prior to the adoption of the policy, Beijing International Capital Airport has been an important transportation hub on a weekly basis. And the flights to and from United States, from Spain, altogether 33 countries. International flights numbered 200 plus on a weekly basis, so the capital airport was faced with a bigger risk of imported cases. Starting from March the 20th, the shift of the first point of entry policy was adopted. The 29,000 travelers have been traveling through other first points of entry. That's diverting a big inflow of inbound travelers. The 5-1 policy have been implemented for each airliner which operates an international flight to and from China can only operate one international flight on a weekly basis. In April, we have 89 international flights through the Beijing International Capital Airport, a big slash compared with the international flight numbers going through Beijing International Airport prior to the adoption of the policy, alleviating the big pressure on the capital airport. In May, The inbound flights will also be 89, 3 international flights, inbound flights on a daily basis. As the quarantine measures improves at these first points of entry, there has been a positive cycle and benign cycle. The guarantee capacity at these first points of entry can ensure the needs.
Thank you. On the right, on the third row, the first reporter in white, please, with CCTV. Recently, many ministries worked out notices to ensure the safety and the health of the international crew members. And what are the specific measures adopted by GACC in this regard? We will have DG Song Yueqian to take the question. Thank you for your question. For aviation and cargo transportation, it is of critical importance to the international supply chain and the stability of foreign trade. For the crew members, they are managed in a closed-loop manner, but we should also provide convenient customs clearance. In this context, the relevant policy notices are issued. Based on the existing practices, together with the relevant agencies, GACC has adopted the following measures to ensure the efficiency. The first is to earnestly identify the agencies and the people accountable for these requirements. The crew management is strengthened. Also, the related postal services and the companies are also asked to honor their duty. The local governments are also fulfilling their responsibilities to curb the spread of the potential pandemic. The second is that we have adopted the closed-loop management and the specific, well-tailored measures against the potential risk. For international crew members, they are managed in a closed-loop manner so that they will not get into contact with the external environment, avoiding the potential spread of the risk. Also, only with a negative anti-AT result can the crew members continue their work. Thirdly, we have adopted the precision management for Chinese crew who stay shortly in other countries, and if they don't get off board when they come back to China, the aircraft will be boarded and for inspection by the border control authorities. And for conveyances that have a short stay in other countries, when they come back to the country, the NAT will be applied to all crew members for further specific control measures. Okay, on the left, on the fourth row, with Hong Kong-China review. Now China is applying the 14-day concentrated quarantine on the inbound travelers. So what are the supporting measures in this regard? Also, after the 14-day isolation period, when the inbound travelers arrive at their home or residences, do they need to continue the isolation or quarantine? We will have DG Song to take the question. Thank you for your question. Apart from the daily life support, we also adopted the following measures to ensure their health and safety. First, we have healthcare professionals monitor the health status of these people, and necessary drugs and medical facilities are put in place. For crew members, they are regular needs for NCD medication is guaranteed. Second, for the quarantine venues, we emphasize a lot on the safety and security of such places in order to prevent the spread of the COVID-19. Thirdly, the respected communities and healthcare and the facilities have set up psychological counseling or supporting team providing humanitarian and psychological services to the targets people based on their needs. As for the quarantine concerning the inbound travelers, the current requirement is that the province of the first point of entry will conduct the 14-day concentrated quarantine. And after that, if the inbound traveler is going back to their home or residence, then they don't need to take the isolation and the quarantine again. And if the inbound traveler is subject to the home-based quarantine, then another 14-day quarantine is required at home. Okay. On the left, on the third row, the lady reporter, please. Thank you. With Hong Kong Economic Herald, the international spread is accelerating. So, what are the measures adopted by NIA to prevent the potential importation by land? We will have DG Liu to take the question. Thank you for your question. As you have mentioned, at the moment, the pandemic importation by land is having rising pressure. The NIA is guiding the local branches and offices to work under the coordinated guidance of the local government and engage in the joint prevention and the control mechanism to guard against the overseas importation. The following measures have been adopted. First, we have strengthened the long-distance monitoring. That means we are closely following the pandemic development in the neighboring countries or in other countries and utilize the early warning mechanism to strengthen the law enforcement between China and the related country, and also to intensify the control measures to move ahead the control measures. And the second is to minimize the cross-border movement of personnel. And the third is to strengthen the containment measures together with the local government and people. We have intensified input into the pandemic containment for any potential entry points. We have strengthened the patrolling and strengthened the punishment against the illegal practices like trafficking and illegal border crossing. And also we have intensified the community management for overseas importation or the inbound travelers. The local communities are mobilized to have stringent control measures. And last but not least, we have strengthened the monitoring and inspection at the entry points. We have adopted very strict control measures in such entry points and also make the inspection more stringent. We have worked together with the relevant authorities to block any potential importation risk and the illegal border entry practices. Thank you.
好，谢谢。
Thank you. Next question, please. Journalist from the fifth row on the right side. Thank you, Mr. Moderator. I'm from the Immigration Management News. We know NIM has adopted an array of measures for control over the airway travels and landway travels. What are the measures adopted for the waterway points of entry? Again, I'd like to ask DG Liu Haitao to take the question. Thank you for your question. To prevent the imported cases through waterway points of entry, NIA has adopted the following measures. First, we made analysis into the collected information. We have been tracking the traces of international cruise ships, conduct a risk analysis, learn about the navigation situation, and prevent the illegal docking, prevent the inbound travelers smuggling into China on the ships, and also for those docked cruise ships, we have strictly monitored their documents. We urge the shipping companies to improve personnel, truck, and vehicle inspection, guide the onboard people to take necessary protective measures, minimize the unnecessary personnel contacts, face-to-face contacts. Third, we've enhanced joint law enforcement. The sea police and the maritime organizations have been working with us in establishing joint prevention control mechanism. The ports, the docks, and the interim docking places have been covered by our inspection and patrolling. We've been preventing the smuggling through the waterway points of entry. Meanwhile, NIA has also proactively supported the shipping companies to resume their business. We have been providing customs clearance 24 o'clock, around the clock. We've also been promoting the paperless online review and approval process, thus reducing the waiting time and enhance the custom clearance efficiency. Thank you. Next question is journalist from the fifth row on the left side, please. Thank you. With Xinmin Evening News. The big slash in international flights have led to the high price in international flights tickets. And if you log on to travel agency to look for the tickets, you will find it has already been sold out. But in other places, you may find some highly charged and overcharged international tickets. Why is that, and how to respond to that? Deputy Director Sun Shaohua is taking the question. Previously, I've shared with you the 5-1 policy, which has contributed to the reduction of imported risks. However, recently, because of the high demand over supply and because of the tight supply, some of the illegal brokerage services have been occupying the seats and then resell it at a much higher price. Some even overcharge a price at 100,000 RMB for per ticket. To ensure the stable and orderly running of international flights, CAAC has issued a notice on the clarification and requirements for the international tickets. Starting from April the 16th, all the brokerage agencies will suspend their business for reselling tickets. Airliners will be the only channels where international tickets can be sold. And for the previous international air tickets that have been sold through the brokerage agencies, airliners should retrieve their ill practices. Standard practices must be promoted. There should be no occupying of the seats in advance and reselling tickets at a much higher price later. We also call on the consumers to buy their international tickets through airliners directly. If customers and consumers find overcharging, they should make complaints. We will collaborate with market supervision and regulation authorities to look into such wrong practices. We will also change the credit rating of brokerage agencies if they violate the standard practices. Next question, please. Thank you. With CCTV, Society and Law Channel, recently GACC and other departments have issued notices on the supervision of exported products, and some of the general public are very much concerned if their private delivery of packages to international market or other countries be put under such supervision. I'd like to ask DDG Song Yueqian to take the question. Thank you for your question. As domestic prevention and control is moving towards the positive, and as the pandemic is still raging in other countries, many Chinese want to send some PPE to their family members in overseas countries, which do play an important role in protecting the overseas Chinese nationals. GACC has been adopting measures to ensure the smooth express deliveries and postal packages to international markets, to other countries. Shortly before, GACC Ministry of Commerce and the CFDA have jointly issued a notice on the orderly exportation of medical supplies. And all these are the regulations on the exported items for private delivery. They do not belong to the category of exported items. Even if they are of medical supplies, they don't need to go with the quarantine inspection tax. Next question, please. Thank you. My question goes to GACC. We know inbound travelers need to fill in the health declaration card, but in some localities, it only has the Chinese and the English language, and it does not have other languages such as Russian and other foreign languages. So there has been some misreporting of the health declaration card because there were no people who could explain what is on this form to the inbound travelers. DDG Song Yueqian is taking the question. According to our policy notices, the initiative of improving the inbound travelers' filling of health declaration cards, the health declaration card is in Chinese and English to facilitate inbound travelers. GACC has translated and issued versions in German, Japanese, Mongolian, Persian, Spanish, Portuguese, altogether 13 language versions of the health declaration cards, so as to help the inbound travelers to refer to the sample in their native languages. To better serve the inbound travelers in some of the points of entry with a higher intensity of certain language-speaking nationals, we've put up samples of such health declaration card in their native languages. We also have the apps. So prior to arriving at the points of entry, they can use their mobile phones to fill in the health declaration card prior to their arrival. Last question. Thank you. I'm from Shenzhen Special Economic Zone News. Suifenhe, the border city along Russia's situation, has caught societal attention because of the mounting imported risks. Some hope that there can be on-site quarantine measures adopted. What are the major challenges to adopt such measures? In the short run, how can we enhance the prevention and control capacity of the local health institutions? Will there be urgent measures adopted to provide medical supplies?
Yeah.
Well, it's a long question. We will have DG Zhou to take the question. Thank you for your question. In the border areas, the healthcare facilities at the county level are indeed the first line against the pandemic, just as people have concerned the entry points by land along the border, like between China and Cambodia, China and Vietnam, and China and Russia. The healthcare facilities at the county level are under-equipped, and their capacity may not be sufficient. That's why, at the moment, the priority for us is to take into consideration the local conditions and set up tailored measures to make sure that every test is conducted and the weak links are strengthened. I think here, first of all, we need to ask the local authorities and the governments to honor their duties. The local party secretariat and the governments should mobilize the provincial resources to strengthen the supplies of the anti-epidemic materials and the human resources. Secondly, in areas with busy entries and also with weak capacity at the national level, we will send disease control experts and medical teams to help the localities to improve the control measures and the treatment capacity. By doing so, we wish to build a sound system covering the early detection, the case finding, the diagnosis, and treatment. We hope to build such a closed-loop case management system. Thirdly, in the light of local conditions at the national level, we will coordinate with the relevant agencies and strengthen our support of supplies, such as the protective gears, guns, and make sure the supplies are adequate. Thank you. For today's press conference, our invited speakers shared with us the latest situation concerning the prevention against the overseas importation, and for tomorrow, the topic would be about services provided to people cured and discharged from hospitals, and we will have experts and government officials from the related agencies. That's all for today's press conference. Thank you all.